Hi, everybody. Welcome back to the World Health Network broadcast. My name is Ben Calderwood. Today on the channel, we're continuing our series of conversations about the state of masking in 2025. Masking being, one of the few COVID mitigations that is still, broadly speaking, accessible to most people. As it comes under threat, we're using this series to take a look at states and municipalities where masking maybe or already is criminalized. And also, we're reaching out to people in states that are making efforts to legally safeguard people's right to mask. Massachusetts is a good example, here in Illinois, where I'm based, which we'll discuss in a later episode, and also in Vermont, which is the focus of our conversation today. As always, if you're inclined to give this video a like or subscribe to the channel, that'll be a big help to WHN, so thank you kindly for that. And now I'm really happy to introduce Kate LaRose, who is the Pandemic Equity Coordinator at the Vermont Center for Independent Living. Kate is coming to us from the from the Northeast Kingdom, which is the northeastern corner of the state of Vermont, and that's going to kind of figure into our discussion about legislation around masking today. So, Kate, welcome to the channel, and thank you for joining us.
Thank you so much. Glad to be here.
So, tell us a little bit about yourself and about where you live in Vermont and about the work that you do for the Vermont Center for Independent Living to get us started.
Sure. At the Vermont Center for Independent Living, we are one of over 400 centers for independent living around the nation. Centers for Independent Living, for those who are unaware, also called CILs, were born out of the civil rights movement for people with disabilities. So, stemming from 504 legislation, and then later being key to helping create ADA. Both of those are super important to the topics that we're going to discuss today. And so I just wanted to throw out mention that we really were, as a Center for Independent Living, not only did we help, did those before us at CILS help craft these civil rights protections, but we also continue to be the ones as people with disabilities, helping other people with disabilities safeguard those and enforce those.
Mhm.
So here at the Vermont Center for Independent Living, we work statewide, and we are people with disabilities working together for dignity, independence, and civil rights. And gosh, it's when it comes to issues of health equity and inequity and ableism, systemic ableism, medical model of disability, and ongoing pandemics, those are all really three key factors in pandemic equity work: dignity, independence, and civil rights.
Let's focus now on what is happening in Vermont, sort of over this past year with right to mask legislation in the state. And I know when we were preparing for this conversation, you really wanted to make a good effort to sort of explain to us the nature of how legislation happens in Vermont specifically, the impact of the nature of, the Northeast Kingdom in Vermont and how that's different to some extent from the rest of the state. So give us a little bit of background about how governance works in Vermont and how that has impacted the course of right to mask in your state.
Sure. So in Vermont, we are a citizen legislature, which means that by and large, those who are elected to be state representatives or senators are working other jobs full time. They are very similar to those that they are elected to serve. So they are not getting paid a professional wage or any sort of benefits. It's better than in New Hampshire, where I think they get like $100 a year for serving. I think in Vermont, our legislators get like 15,000. But it's not. It's not a. It is definitely a citizen legislature, and they don't have staff. So if you want to talk to one of your elected representatives, you pick up the phone and call them at their house,
Mhm.
or you run into them at the grocery store and talk to them about what's important to you, or when you see them at the dump on Saturday, that is when you talk to them about the things that concern you and your family and your community. So when it comes to the right to mask legislation, that definitely played into it because, in other places, you might have to go through 4 different layers of staff. There might be a very formal process to talk about, oh, there's this need. How do we actually turn this into legislation? In Vermont, it was a little bit different. We're definitely looking at what was happening in our neighboring states, like New York, with the tides turning and taking away from people their right to mask, which is an infringement of a civil right. It is taking away assistive technology. It would be akin to a state saying, or a county, or any sort of governing body saying that you cannot have hearing aids or a wheelchair, right? Like this is a respirator mask is assistive technology. So we were starting to grow a little bit concerned about it because we were hearing from our peers that they in turn were also growing concerned. And this was in January, which was the start of our session. Our legislative session in Vermont starts in January, and then it goes into May, sometimes June. This year was later. And it's part-time. They're not there all throughout the year. So we started getting some concerns from the peers that we serve. And in Vermont, one thing that we're very fortunate about is that we have our own state level legislation and protection of the ADA. It's like our state level ADA that dovetails and complements the federal legislation. In the past, it was seen like maybe that was duplicative. Now we're realizing that that is not, in fact, duplicative, and it's going to be very important in the years to come as federal civil rights get stripped away from us. But so it was on the radar, but it didn't seem like top of the list of priorities because a lot was happening in the state, particularly with our unhoused populations. And then on January 20th, along the border in the Northeast Kingdom, there was an incident that happened that I think most people around the nation have heard about. There was an individual who had, I don't even know if it's alleged that they shot a Border Patrol agent, but a Border Patrol agent was shot and killed. Another person was also shot and killed. And all of the local news coverage, the local coverage, was really focused, hyper focused on the fact that 2 of the people involved in this situation were wearing N95 masks prior to the altercation. So it was a lot of interviews at the local hotel where they were staying, with like the desk clerk saying like, oh, I knew they were sus. They were wearing, masks. Clearly they were up to no good because they were wearing masks. So, it's that level of reporting. And when just sort of overall, I think people have this concept of this Vermont ideal in their mind. And it's like, oh, it's Bernie Sanders land. And it's the land of, peace and Ben and Jerry's ice cream. And it's super, super blue. And that actually couldn't be further from the truth. We are, like most everywhere at this point, we are very purple. And when you look at any town that touches the Canadian border all the way across, it is consistently red. So these are local communities that in local elections and federal elections, consistently for many years now, they all go full red. And even with our statewide administration, for the last few rounds of the administration, the governor is Republican. That means that he has a lot of power when it comes to vetoing. That means he also has a lot of power when it comes to the direction of state government, such as a state agency of health, because of the appointments that he is able to make. And so the reason I mention that is that for the last gubernatorial election, I think every single town voted for overwhelmingly for the Republican governor. So I don't think there was one single town, there may have been one out of like 200 that voted for the Democrat. So so all of that to say that Vermont is not this ideal Bernie land that people tend to think of it as. And as we started hearing the pushback very quickly after that January 20th shooting of masking, we realized, oh no, this is going to move. And when it does start moving, it's going to move very quickly. And the places that are going to be most poised to ban masks are going to be the local select boards in those border towns. So for those reasons, we realized that that was a priority and we bumped it up and started moving on it really quickly in January.
So these are concerned about local municipalities making an effort to ban masks as part of a reaction to this incident that occurred at the border that you described.
Yes.
Um, I think I wanted to jump back just a moment. You mentioned that as part of disability advocacy in the state, you were sort of keeping an eye on what had been happening in New York. I think you're referring specifically to Nassau County in New York, which banned masks, as well as
So,
numerous efforts in New York City as well about, potentially banning masks on the part of Mayor Adams and other
yes.
individuals, Governor Hochul, et cetera, et cetera. Just want to be specific about that for the audience. So moving forward, understanding the background of what the sort of the genesis of this effort, what is the status of the right to mask legislation now? Tell us a little bit about where it sits in the Vermont legislature at this point in time and your efforts on its behalf.
Yeah. So fairly quickly, when we reached out to some of our allies in the Vermont legislature back in January, I think we reached out on January 20th or January 21st, and we had um, legislation, draft legislation ready to go a few days later, and then it was
Wow.
introduced not too long after. So um, we had allies and champions in both the Senate and in both the House, and we worked with them together to be able to introduce companion bills in both chambers. And
Mhm.
we actually we were looking at what a nice, simplistic but very protective measure would be in like the language, and we actually settled on Massachusetts's language as the template for that because it's very short and sweet. And let me just even read that. Because when the legislators had reached out to legislative council, the attorneys who draft for legislators, because again, there's no staff with any of the
Right.
legislators, they all collectively share this legislative council group of attorneys. Um, the the understanding was that, gosh, we already have good protections in state law. So the state would never be in a position under current law to ban masks, but it looks like municipalities could. And so
Mhm.
here is the bill as introduced. Except as otherwise provided by law, no municipal corporation, by ordinance, resolution, rule, or other enactment, shall directly limit or prohibit the use of hygienic face masks. And then it goes on to say the provisions of this act shall supersede any inconsistent provisions of a municipal charter. That seemed like that could have been a workaround that wouldn't have provided full protection. So that was the short and sweet bill as introduced. And again, we had it both in the Senate as well as the House. The Senate bill was pretty exciting because there are 30 members of Senate in Vermont, and including the sponsor and co-sponsors of the bill, there were 15 of the 30 members of Senate who were either sponsors or co-sponsors. Noteworthy is that it had tripartisan support. We have a strong third party here in Vermont, the Progressive Party. So it was sponsored by a progressive, and then Democrats and Republicans both co-sponsored. Um, and the current status, because there were so many big things that were happening that needed to be wrapped up before the end of the legislative session, it did not get off the wall this year. It was referred to committee, and
Mhm.
it is still in committee. Our legislative sessions are bienniums, so you have 2 years once legislation is introduced at the start of a biennium year, which 2025 was, to be able to do something with it or not. So this bill is still there in the committee, kind of hanging out, waiting to get its day. And that is the current status. It didn't no activity was able to be done on it in the committee before they wrapped up.
So next steps, tell us a little bit more about how that biennium works. When do you anticipate legislators revisiting this bill? And how confident are you that it will actually make it to a vote and potentially pass or not pass? What do you think is the future of this legislation?
So we were feeling pretty confident about it in March and April. We were
Mhm.
hearing from all senators. We had a lot of people, a lot of our peers reaching out to their elected officials. Every response from every elected official was super positive. Yes, I will vote yes on this, should it come to vote. The committee, actually, the chair of the committee said, "Gosh, we have all these things that we need to deal with: education transformation, making sure that we're addressing the needs of our most vulnerable who are unhoused. Vermont is second highest in the nation for number of unhoused people per capita. So there's a lot of priorities happening, and ultimately, what we were told by the committee chair is that they did not feel like there was any risk of a municipality banning masking in the near future. And the moment that they heard that any municipality was banning a mask, then they would move it forward. But given the other priorities, they didn't feel like it was a big deal at the time.
Interesting.
That said, now it is July. A lot has happened between March and now. So now we have many, many more people on the left that are now opposed to masking because masks are being used by people who are saying that they are ICE agents. We don't even know if they are, who are kidnapping our community members, and they're using it to conceal their identity. So now we're just in a very different place. And we still have many months to go because they won't be reconvening again until January.
I see.
The other thing that has made it a little bit of a harder road to traverse is that our companion bill in the House, the sponsor, Representative Cordes, was receiving death threats, and she recently, a few weeks ago, moved out of the country. And so we are uncertain what happens now until we are able to get another champion, as Representative Cordes was.
Sorry, can I follow up on that? You're saying one of the sponsors of a companion bill, I believe you said,
Yeah,
was receiving death threats and has left the country. I wanted to, she was receiving death threats because of her action around this bill specifically or for
no.
unrelated reasons. Okay.
I think for being an amazing advocate for civil rights in general.
No kidding. Um, I'm very sorry to hear that. I suppose that absolutely backs up your statements earlier regarding Vermont not being the Bernie, Ben and Jerry's paradise that some people may assume that it is. Um, what a development that is. Can I ask, considering it's an almost impossible question to answer because you're absolutely right that the political calculus has changed, I think, substantially. We're not sort of talking only about disability advocacy in the context of protecting yourself from airborne viruses, other reasons individuals might choose to mask, et cetera. That situation has grown more complicated. Let's use that thought, I think, as an opportunity to maybe take a step back and move on to our next question, which we've alluded to so far. Fundamentally, why why is the right to mask important? Why does it matter to you? Why does it matter to the individuals that you serve and that you work with as part of your disability advocacy?
So, given the history of Centers for Independent Living and having brought about such bold legislation and civil rights protections like 504 and ADA, like I think until I became more involved with our Center for Independent Living, I didn't know the full extent of our shared history and our shared collective struggle, right? And so during this time of 504, this was a time when people were demanding their rights to be living in community because the medical model of disability was saying, nope, you need to be confined and you need to be confined in a congregate care facility, and we are in charge of you. We are in charge of you. We get to make the decisions. We know what's best for you. And so this community living movement to be out of congregate care facilities, to be able to have the right to live our own lives and have civil rights is really key to everything we do. And the thing where we start seeing civil rights being eroded is where we start collectively deciding amongst ourselves or in decision-making rooms or bodies that, you know what, that one civil right, not that big of a deal to me. Let's take that one away. And that's the start of everything. Disabled people know, this is how it begins. And so fundamentally at its core, the right to mask is about bodily autonomy. Our bodies, our choice. It is 100% about bodily autonomy. And more than that, it's about being able to have access to assistive technology without having to prove anything to anyone. For people who are disabled, our peers who are trying to have access to live in community, to work in community, to go to school, to exercise their civil right to vote, every single day, it's barrier after barrier. Some of those barriers are systemic. Like in Vermont, you cannot vote in over 150 towns right now unless you're there in person for 5 hours. And some of them are attitudinal. And so an attitudinal barrier will look like the feeling and the rapport that you get from a select board member or from a teacher or from somebody who is in a position of power, a social service agency, for example, who is the gatekeeper to something that you need or want. So having to prove to people that your assistive technology is legitimate assistive technology, like this is what other states, they're trying to do carve outs, like, oh, but if it's for a legitimate medical reason. No. We don't do that, because then who gets to decide what is a legitimate reason? We're not going around and telling people with hearing aids or wheelchairs, prove it, right? It's a civil right. You're able to have that as an assistive technology, and you don't have to have a diagnosis or the backup from a medical provider to say, yeah, that's legitimate, nor should you have to or have to prove it to anyone. So the fundamental right to have assistive technology without having to prove anything to anyone is very important as a civil right. It's also a health equity issue. We know that the people who are at the greatest risk of harm are already the people who are experiencing the highest rate of health inequity. And this is certainly very true in rural areas of the state where it is most likely for these sorts of bans to be passed. And then more broadly, you shouldn't have to be disabled, or you shouldn't have to know a disabled person or be a family member of a disabled person to be able to access a respirator. Anybody who doesn't want to get sick, anybody who wants to protect themselves from wildfire smoke. We just had air quality index yesterday, I think in the 80s or 90s.
Here in Chicago as well. Yep.
Yeah. Anybody who doesn't want to get sick from environmental contaminants. It was July 10th last week. It's our third July 10th in a row where we had massive devastating floods and like swift water rescues were used. And people use respirators when they're mucking out their basement the days after a flood. So there are myriad reasons why masks are important and shouldn't be banned. But number one, first and foremost, on the civil rights front, is that it's about bodily autonomy.
What sort of you've laid this out so eloquently. Tell us a bit more about what shape this sort of advocacy work takes when you have these discussions, and what sort of challenges people in your position face when advocating for this sort of legislation, when advocating just for this kind of awareness about masking specifically, but also about what you're fundamentally trying to explain about where masking sits relative to bodily autonomy and the rights of disabled individuals more broadly.
Yeah. My favorite not favorite response of particularly people in power or in government systems when disabled folks bring a really important need or barrier up to them is when they say, oh, but there's laws that protect you, right? So we're sharing the pain of our day-to-day reality where we are exhausted because we have just spent every last spoon filling out the paperwork, trying to track down those phone numbers, trying to jump through all the hoops that have been given to us. And like, there's always new hoops, right? And then filing the complaints when the law is broken, right, on a daily basis. So like, we'll go through all of this. We'll finally bring it up to a decision maker and say, hey, this is a big enough deal that we're actually bringing it up to you. Like, we have like lots of deals that we deal with every day that like we just can't possibly like, but this is such a priority that we're bringing it up to you. Hey, Secretary of State's office, for example, we can't vote. And so then you get the response of, oh, but there are laws. There are laws
Mm,
that protect you. And what you could do is you could file a complaint with these three different agencies, right? And that may be true if one, those agencies were staffed to be able to follow up on all the complaints. They are not. The protection and advocacy organizations, the legal organizations are getting zeroed out, it sounds like possibly in federal budgets. Two, if you have, what's it normally take? Probably about 3 weeks of 40-hour weeks to be able to put together the complaint and do all the follow-up work and the investigation participation, which is also painful because you're having to relive trauma over and over again of what had happened to you as an individual with a disability. Um, and three, if you have about 2 to 3 years to wait for an outcome and a decision. So the reason I share all of that is because people in power love to tell disabled people that things that are very much, in fact, an issue in the day to day lives are not an issue because there are laws. And yet we know that systemic ableism and personal ableism, illegal as it is the norm. So if we don't move forward with global protections for everyone, then we know that the civil right will be eroded and it won't exist for anyone.
I, I, I want to reiterate something. This topic comes up so much when we at WHN have these conversations around this sort of legislation, around long COVID advocacy
Mhm.
specifically, and because part of our efforts is speaking to non-disabled allies specifically and helping them
Mhm.
understand why their attention and participation is important, to try to build some empathy around understanding how much extraordinary energy and effort is put upon individuals whose energy is already so very taxed by virtue of the disabilities they are dealing with on a daily basis. For lack of a better metaphor,
And I will just say it's not on the basis of their disabilities, right? Because
right?
disability is not the problem. It's the systemic ableism. It's because of
It's
the
yes,
constructed barriers. Yeah.
yeah. It's barrier after barrier after barrier, and people in these positions are forced to, you know, again, for lack of a better metaphor, to sort of build the plane as they are flying it in terms of negotiating legislation and protections for these things that they should not, no one should have to make such efforts to do that, to push back against that systemic ableism that you are describing. I think that's
And
just something that we make an effort to sort of deliberately reiterate when we get the opportunity to do so. So thank you
I
for
will add
describing
that
that.
while we are deliberately building the plane while we're flying it, we are also packing parachutes for everyone on that plane.
I, for for every other potential plane in the air, anywhere.
Hmm.
Um, because as you said a moment ago, when those protections go away, they go away for everyone, disabled or otherwise. Um, and it's very easy for individuals who are not disabled to assume that will always be the case, but of course, not so much. Um, as we so I'll remind our audience, just so we sort of touch on right to masking in Vermont once again. I believe you said, just to restate very quickly, that that legislation will be back on legislators' desks, so to speak, early in the next year. Is that correct? I just want to make sure that okay.
Yeah, on the wall
On
in
the
the
wall, sorry,
committee.
on the
Yep,
wall.
it's been assigned on the wall in the committee. The other thing that is not a popular talking point among any of us who are living in this world right now in 2025, over 5 years after the start of this pandemic, of the COVID pandemic, um, is that to the question of why is this important is, history demonstrates to us that on the heels of pandemics come fascism. And
Mm,
there are a lot of opinions and thoughts about why that might be. From my experience and the work that I've done the last few years, what I'm finding is that people as a whole, individually and as systems, are, maybe it's trauma response, maybe it's just a level of exhaustion across the board, a lack of deriding empathy or degrading empathy that's continuing. But things that used to be really easy comparatively for disabled people, so like it's not anymore. So for example, uh, 10 years ago, people with multiple chemical sensitivities could walk into a building, maybe where they had cleansers or something like that they know that will flare their condition. They will wear a respirator mask. 10 years ago, they would not be mocked, they would not be derided, they would not be yelled at by their medical providers, right? And the same with, like, we're just seeing it over and over and over again. Last year, there was a baby who was in the NICU. I was going to say who was high risk, but every baby in the NICU is at high risk. They are in the NICU, right? It was
neonatal
during,
intensive care unit. Yes, I
yes,
want to spell that
yep.
out. Yeah.
So these are babies who are on oxygen, who are on breathing machines, who have maybe already coded and died once. That's why they are in the NICU. 12 years ago, when I had my baby in a hospital setting, my baby was born, we did not know that there was any high risk conditions, but just by virtue of being a baby, newborn, every visitor that came into or out of that unit was wearing a surgical mask. Like the
Yep.
nurses would be like, here, will you wear this to protect the babies? And like, yeah, of course. Yeah, sure. Babies, we want to protect babies. Uh, Now, flash forward 10 years in the future, in the NICU, the nurses were coming in sick. They were telling parents who were concerned about their babies getting sick during an RSV surge, a flu A surge, and a COVID surge. That yes, those other patients, parents that were in there that are actively coughing, that are actively sick, that they don't need to wear masks. It's you do you. So it's, everything has completely changed. This is never how it's been before. This is completely new in terms of just the level of lack of empathy across the board. And very early on, there were a lot of respected journal articles in 2020, 2021 that said, this is what the beginning of eugenics looks like in policies. When it comes to leaving people in congregate care facilities to die, when it comes to making sure that there's no provisions that protect people who are incarcerated and forcing them to stay with cellmates that are sick. This is eugenics. And so now we're 5 years in, and nobody is using the word eugenics anymore because it has become common practice and accepted, and that's when the risk is highest.
I have no follow-up to that. I think I always qualify statements like this saying, how can individuals miss that trend because it is so blatant and so alarming. I have to qualify statements like saying that by saying for those of us who are paying attention, because it is a lot easier still to look the other direction, of course. Um, so thank you for calling attention to that. Um, Before we go, uh, any other additional thoughts about focuses on, beyond masking? I think you've covered it, of course, in terms of disability advocacy, things that we should be thinking about and focusing on as we have these discussions and keep going into 2026.
So my child is a middle schooler. My child's 12. And when you are 12 years old, you feel like wherever you are, everyone is talking about you, everyone's looking at you, and you're the center of attention, right? That's developmentally, as a 12-year-old, I remember painfully what that was like.
Oh boy,
And when
so
you are a disabled 12-year-old and you have chronic health conditions and need infusions every few weeks to keep you alive, and you are wearing a respirator, it is probably a little more true that people are looking at you when you're walking into a room. And so what I have to remind my kiddo and what we talk about is when she is, and again, I just want to be really clear, this is putting the burden back on people who are already experiencing the painful burdens of inequity, and that's never okay. And yet here we are. Um, she will often, in 12-year-old fashion, be very upset at the adults around her who are mocking her for taking actions that she needs to take to keep herself safe and healthy. Um, and so some of the things that we talk about in terms of how to hopefully tap into people's empathy is rather than responding with anger, although trust me, I am plenty angry, um, is talking to them and inviting them in to think about the framing of what it is that they're doing. So I'll give you an example. We were in our cappers at a location a couple of weeks ago, and there was an adult who was calling over other people and laughing and pointing at my child, and just like kept calling more people over. They had their phone out at one point in time to start videotaping us. My kiddo didn't see what was going on. And so when we got up to where this person was, my kiddo was not within earshot. She had gone elsewhere. I made a very big effort to explain that my child was receiving an infusion the very next day to protect her life, and that we were so grateful for their understanding to not make a big deal out of the protection she has to take to stay alive, and to just thank them for being so understanding. And it took a lot out of me to do that. And this person was in front of another person who did not know that they had been making, such a fuss out of it and acting like a baby about my child's actions. They were ashamed. They were
hmm,
completely ashamed because they knew that picking on a sick little kid is not okay. So the reason I share all that is in this time of lack of empathy, there are still always going to be some topics where we could collectively agree, at least on the surface, that it's not okay, right? Like adult making fun of sick kid, not okay. So find for the advocates who are listening to this, find whatever it is that is generally accepted and work that into the narrative, right? Because we still have some empathy threads that bind us. It's a lot few. The rope is frayed. There used to be like a whole bunch, like dozens of threads that bound us when it came to empathy and connection to community, and caring for one another. And now, depending on the day, it feels like maybe there's like one thread left. Find that one thread, try to strengthen it, try to build on it. And for everyone else who's not an advocate, who is just sort of part of the general public, like look around and see what you can do to make things better, because this is literally life and death for our community, and there is no excuse. Like be ashamed and do better.
Kate LaRose, I want to thank you so very much for giving us your time today, joining us on the channel, talking about the state of right to mask law in Vermont, and of course, the state of disability advocacy much more broadly. I should probably also thank your 12-year-old child for her grace in the story that you just shared. We, of course, are the World Health Network, a global organization working to end the COVID pandemic as a global health threat and reckon with growing public health challenges in 2025 and beyond. You can check us out online and learn more at whn.global. We really hope you'll visit the website and consider participating. Thank you so much. We'll see you in the next broadcast. Bye-bye.